Hello, my name is Kate Kelly. I'm a graduating Master's of Social Work student at Temple University. And for the past 2 years, I've done my fieldwork at the Public Defender's Office here in Philadelphia and have gotten the opportunity to analyze some data for them from a client survey that looked at childhood trauma and adult mental health among people with serious criminal charges. So I want to say thank you to the defenders for this opportunity to work on this project. Thank you to the respondents who shared their life stories, and thank you to the social workers who collected the data. I think this quote from researcher Bruce Western, who authored the Boston Reentry Study, really primes us for the information I'm about to present. So I invite you to pause the video and read it. Just for some background, we know that traumatic experiences in childhood can have impacts on adulthood outcomes, specifically mental health. And we know that mental health is related to criminal charges, but we don't know a lot about the mechanisms that link all of these points. So the objective of this study was really to identify the relationships between childhood trauma and adult mental health, as well as adult mental health and charge category. It was a voluntary convenience sample of 104 public defender clients who had first degree felony level, so F1 charges. The instrument was adapted from the Philadelphia Urban ACE survey and was administered by social workers from 2019 into early 2020. And for this analysis, I used frequencies and crosstabs with chi-squared significance testing that examine the relationship between child abuse and adult mental health, as well as adult mental health and criminal charge. So this graph just shows the distribution of charges among the sample. You'll see that robbery, rape, and aggravated assault were the most common charges. And while attempted murder and burglary were not large enough for significance testing, those cases are included in the aggregate when comparing the top 3 charges against all other charges. In terms of results and findings, when we look at child abuse and in mental health, we see high rates of both throughout the sample. 42% experienced physical and or sexual abuse when they were children, and more than half the sample reported a mental health diagnosis. Those who reported child abuse were significantly more likely to also report a mental health diagnosis than those who were not abused. And if you'll look at the graph on the left, you'll see the proportions of abuse experience by mental health status. And you'll see that, anybody with a mental health diagnosis, the respondents were more likely to report child abuse as well, but that the difference is especially significant in the post-traumatic stress disorder, PTSD category. There's a large gap. And when we look at mental health and charge category, we see some really interesting variations among charges, and also we see PTSD come up again as a significant finding. So those with an F1 aggravated assault charge were significantly more likely than those with other charges to report a mental health diagnosis, and specifically, they were significantly more likely to report PTSD. So you'll see by the graph, the large bar on the right, nearly 80% of people with an aggravated assault charge reported a mental health diagnosis, and nearly half of people with that charge reported specifically a PTSD diagnosis. Conversely, those with a rape charge were significantly less likely than other charges to report a mental health diagnosis, and they were unlikely to report PTSD. So from a social work standpoint, this finding around PTSD makes a lot of sense because we know that this condition can present with hypervigilance or aggression, difficulty navigating conflict or de-escalating situations. So from a clinical standpoint, it makes good common sense that people struggling with PTSD symptoms might find themselves in situations that are more likely to contribute to an aggravated assault charge specifically, versus different types of situations that lead to different charges, such as rape or robbery. And I believe that PTSD starts to emerge here as a possible mechanism linking these points. I think the implications of this study are fairly straightforward. It underscores what we know about childhood trauma impacting adulthood outcomes, including mental health. The variation among charge types suggests that there are different pathways and causal factors at play. But I think most importantly, this underscores the need for prevention of violence against children and the need for timely treatment of trauma when it happens to prevent these negative adulthood outcomes. And I think the data also challenges us to reconsider adult behavior in light of childhood trauma and ask ourselves, is this person with this criminal charge truly aggressive, or are they traumatized? And if they're traumatized, what is the appropriate intervention that truly promotes public safety and collective well-being? So thank you so much for your time and for watching my presentation. I hope you have a great day.